Welcome to today's press briefing. We have with us Dr. Zhuang Shukwon, Head of Communicable Disease Branch, Center for Health Protection, Dr. Linda Yu, Chief Manager of Clinical Effectiveness and Technology Management Hospital Authority, and also Dr. Aoyang Kamchun, Chairman of the HA Coordinating Committee of Obstetrics and Gynecology. Dr. Zhang will give you an update. We recorded 45 confirmed cases of last night from 9109 to 9153. 3 of them are imported cases, 42 are local cases. For local cases, we have 22 untraceable cases and 4 related to the Lam Tin Chuan Kwan O cluster. 3 of them are family members and the other is a worker. Altogether, for the related cluster, 32 cases have been recorded. There are also 16 cases related or with linkages with other cases. For the untraceable cases, 1 relates to a nurse working at the outpatient clinic at Baptist Hospital. She started to have a runny nose on the 3rd of January and started to have a fever on the 6th of January. That was the last day she went to work, and contact tracing has been made, and so far no close contact has been identified and quarantined. This nurse conducted examinations and took samples from patients. All these 3 patients tested negative, and the nurse also donned full personal protective equipment. We also have 3 new buildings subject to compulsory testing. These are Kai Ching Estate, Yan Ching House. 2 units are affected. 2 cases have been confirmed, and they are on different floors at different units, and also Mei Tin Chun, Mei Sao House of Tai Wai, involving 2 cases on different floors and different unit numbers. And New Reclamation Street 26, there is an additional case today involving a new unit. Previously, 2 units were identified. The cases concerned were traceable. As for this additional unit, the confirmed case is currently untraceable, and this building should also be subject to compulsory testing. In Fong Chak House, we have recorded 3 preliminary positive cases involving a family. Just a moment. These 3 persons were subject to compulsory quarantine on the 7th of January. They felt unwell but did not see a doctor. But then upon testing on the 7th of January, they tested positive on a preliminary basis. Let me remind members of the public once again that if you have mild symptoms or feeling unwell, such as a runny nose or a sore throat, please get tested and consult a doctor as soon as possible to prevent spreading of the virus among the family. That concludes my reporting today. Dr. Yu. Good afternoon. As of 9 a.m. today, over the past 24 hours, the hospital authority system recorded 65 reportable cases. In the past 24 hours, 1 patient in a public hospital unfortunately passed away. So far, 151 patients have passed away in public hospitals. Over the past 24 hours, 49 patients have been discharged upon recovery. So far, 8,306 confirmed patients and 1 probable case have been discharged upon recovery. And so far, 616 patients are receiving treatment in 23 public hospitals and the community treatment facility at Asia World Expo. 43 are in critical condition, 46 in serious condition, 527 patients in stable condition. We have 2,513 negative pressure beds available with an occupancy rate of 58.3% and 688 negative pressure wards available with an occupancy rate of 69.5%. I'd like to report 2 incidents involving an operating theatre in Chuan Kwan O Hospital. A patient care assistant has tested preliminary positive. The assistant started to feel unwell on the 6th of January, and she had been providing care services to patients, helping patients turn in a bed, and no close contact had been identified as patients because the PCA had been wearing PPEs. As for the colleague a colleague has been regarded as close contact and will be quarantined, but no patient has been regarded as close contact. The hospital is now conducting contact tracing. As for the inventory level of PPEs, we have 76 million facial surgical masks and 700,000 face shields, and also the inventory level should last us for 6 months. We've reminded hospitals that PPEs should be used where appropriate, and the management of hospitals should make sure that there is a sufficient level of PPEs for use by our staff. We've also reminded colleagues that before conducting procedures for patients, colleagues should stop and think first what PPEs should be used, and if higher level of PPEs should be used, such as N95 respirators or eye or face shields should be used, then they should be used without hesitation. Next, Dr. Aouyang Kam-chun will give you an update. I'd like to brief you on the obstetric services in HA. Between March and December 2020, 29 pregnant women had been diagnosed with COVID-19 and had received treatment in our public hospitals. 18 babies were delivered, tests were conducted, and all were found to be negative. However, since this is a novel disease, we do not have a lot of knowledge on COVID-19. So the hospital authority has put in place a number of arrangements to prevent the spreading of virus in the ward. For example, screening would be conducted at the time of admission for pregnant women to make sure that isolation, negative pressure wards would be used for the delivery of babies, and colleagues therein have been provided with step-up training. We also have sufficient protective gear for frontline staff. I'd also like to remind pregnant women here, although there is no evidence showing that there is a higher risk for pregnant women to contract the virus, nevertheless, they have to be extra careful. Please avoid going to crowded places, and they should also make sure that they observe social distancing at all times and pay attention to personal hygiene. Even for the mildest symptoms, the pregnant women should seek medical consultation as soon as possible. Earlier, because of the epidemic situation, the hospital authority had suspended the service of allowing husbands to stay with the expectant mother in the ward. Now, we have heard voices in the community and different suggestions and advice from experts, and we understand that the accompanying person should help alleviate pain during delivery and could soothe the pregnant mother. And that is why, starting next Monday, this service will be gradually resumed on a limited basis in hospitals. However, personal hygiene should be observed, and infection control measures should be put in place as follows. First, all expectant mothers would be subject to COVID tests at the time of admission, as well as the accompanying person. The accompanying person should also be able to provide a negative test result conducted within 3 days, and the accompanying person should not be somebody subject to quarantine. And we suggest the accompanying person to get tested when the trimester has been reached to get fully prepared for the delivery. And there are also other infection control measures. For example, the accompanying person should not exhibit any symptom of fever, and the person should also be should be wearing a gown. Depending on the request, even if the accompanying person has not conducted the test within the past 3 months, if the accompanying person has not come into contact with any confirmed case, doesn't live in any building with confirmed cases, then permission will still be granted. However, infection control measures should also be observed. And after accompanying the expectant mother in delivery of the baby, the person should get tested as soon as possible. We remind expectant mothers to be admitted to hospital as soon as possible when it's time for labor, because time is needed to arrange for COVID tests to be conducted. And also for the accompanying person with a negative test result, then the accompanying service can be allowed.
Who has questions? Lady over there. Apple Daily, I want to ask about the two nurses, that is among the nurses in Chengdu and the nurse at the outpatient clinic at Baptist Hospital. Would you actually carry out testing for the patients that they've cared for to avoid any transmission of the virus? And for the two nurses, are they joining any high-risk activities or meals? And the second question is for New Reclamation Street. Which level is the case on? Do they know the latest case? Do they have any contacts with the previous case? Is it that there are, number 26, is that a ground floor shop? Does it mean that the entire block there has to be actually tested? Anyone needs to be quarantined? And Feng Chek House has some preliminary cases. Do you think the people there needs to be evacuated? That is, the two cases, are they related by environmental contamination? And also Food and Environmental Hygiene Department, is it that in the department there are two close contacts found to be infected? Changguan Hospital, the care assistant, her job nature is mainly providing support basic services, so that she might actually help turn the body of a patient or provide other assistance. But when she performs her duty, she will wear PPE. And in the hospital, there is a whole set of anti-infection measures in place, so there's no chance of her spreading the virus to patients. The nurse at Baptist Hospital, she was only on duty for 2 days, and she wore adequate PPE in helping 3 patients to provide specimens. One of them is a colleague of hers, and the other was a patient in the hospital, and the other is an outpatient patient. 3 tested negative. The outpatient patient had left the hospital, so we'll take follow-up action. We have suggested that the person who went for outpatient clinic actually to arrange tests for other colleagues there. For the New Reclamation Street site, the 2 previous cases, they didn't know each other, but they had their own sources of infection. And for today's case, it is actually is on the same floor with as the other case. The previous cases were on different floors. Feng Chek House, the new case, it is on a different unit. Let me check further. Earlier on, there were 2 units affected. Altogether, 5 patients from both units, and the latest case is on a different floor, facing different direction. The previous 2 cases faced the same direction, but were on different floors. This sort of building with various, of the 40 plus buildings, they are similar units actually. On the whole, in the New Reclamation Street, number 6, for people who have stayed there for 2 hours, those people will need to be tested, dating from the 26th. For the nurse, well, she would have had bills with her family members or friends. Okay, this lady in gray shirt from cable TV. I want to ask about the number of confirmed cases today is higher than the previous 2 days, and also a number of cases without sources. It made up half of the local cases. Do you think this is a worrying trend? Is there a sign of rebound? And today's cases, is it reflecting actually the result of people gathering or partying over Christmas and the New Year? The BU nurse, what's her case number? And also, earlier on we saw cases where clinic nurses have symptoms, but they had not seen a doctor and continued to go to work. So has the Center for Health Protection found that even nurses themselves, their awareness isn't high enough? When they have symptoms and yet they continue to go to work, would you usually appeal to them? And also, you said at Fung Check House, the 3 preliminary positive cases. When did they feel unwell? Had they actually been delaying going for a test until the last minute? Why didn't they go to see a doctor? When did they start to see symptoms? Today's numbers, yes, has increased. Half, actually, of them have no traceable sources. The preliminary positive cases, a number more than 40. So there seems to be a bit of rebound or fluctuation in the numbers, but it doesn't. Well, it shows that the pandemic is under control quickly. It's worrying, but it may reflect, late last year, early this year, the fact that there are lots of people on the streets during the holidays, so there could be some transmission going on. For the cases without sources, it's not that not all of them went to same kinds of gatherings, but there could be some invisible transmission. When there are large crowds on the streets, then the transmission could become more serious. So more people got infected. Fung Check House, the 3 preliminary negative cases, they didn't really delay treatment. All of them had undergone compulsory testing on the 29th and the 2nd of January, but 3 of them had mild symptoms. Of them, 1 had a runny nose on January 5th. The other 2 on January 7th had sore throat or lost their voice, therefore they went for testing. So it's not that they didn't have symptoms at all. How about the case number of the Baptist University nurse? 9138. Next question. English question, maybe?
Question from RTHK. First of all, how can the companions being tested in advance when pregnant women may give birth at any time? And are you worried about there is a risk of transmission if this service is resumed? And also, second question is there is a slight rebound on the cases. Is it because of the silent transmission on the streets, or there are also proportionate amount of people being infected by some kind of New Year gatherings? Is it worrying? Thank you.
Oh, thank you. It's not easy, okay? I think it's a balance between the workability of such arrangement for the accompanying the pregnant woman in labor. So we understand that the pregnant lady may go into labor at any time. So we would advise those at term pregnancy, if they want to accompany their wife or their partner, they should try to arrange the test in a regular interval in preparation for that. So we accept any negative test for the past 3 days. So in reality, I understand that they may need to repeat it every 3 days until their wife or their partner deliver. So it's a quite demanding, but I think it's one of the that both sides need to pay, okay, for achieving a good outcome to let the partner to stay with the mother during labor. Okay. We are not too worried in that sense because we have already been introduced the admission test for the wife together with the negative test for the husband or the partner. We believe that the chance, okay, of the infection by this accompanying person should be quite low because that person should, or most of the time, would already be staying in the same household with their wife or partner before the mother was admitted for labor. So either they should be infected together or the chance is very small. So it's probably not that related to the threshold or the number of cases in the community.
We are seeing an increasing number of cases, especially unlinked cases in the community today. So although this is only 1 day, we're not sure whether there's actual rebound of the cases. But this signifies there may be still some quite significant silent transmission in the community. And also when I look over these unlinked cases, then most of them do not have a definite mass gathering during end of year or the early January. They mainly they are sporadic. So this also signifies there may be other silent transmission, not only the gathering. Maybe there are some other cases we do not know yet in the community.
Next question. This lady in the middle. Good afternoon. I'm from Oriental Daily. We have 4 new cases regarding the Chung Kwan O Lam-Tin Tunnel. 3 belong to the same family. Well, has work been suspended at the construction site? What about the confirmed workers? Have they been working at other sites as well? For the nurse at Baptist Hospital, she still went to work on the 6th despite starting feeling unwell on the 3rd. What was her CT value? What is the risk of her transmitting the disease to outpatient clinic patients? And also for birth companions, do you have a daily quota? And about the discretion to be given, are there any criteria? How should the birth companion show proof that he does not live in the building with confirmed cases or that he has not come into contact with any confirmed cases? And also for the test, is it that all pregnant women whose labor is due in 3 months would be able to use the new birth companion service? For the related cases in Lam-Tin Chung Kwan O Tunnel, the cases are identified in quarantine centers. This is expected because since they have been sent to quarantine centers, they're expected to be possible contact or confirmed cases. As for the nurse, she didn't come into contact with a lot of patients. Perhaps at the outset, the symptoms have been quite mild. She therefore continued to go to work. But then they should also be vigilant because healthcare staff do come into contact with patients, so I urge them to get tested or see a doctor as soon as possible when the mildest symptoms appear. As for birth companion, we do not have a quota. As long as there is a request from the husband or spouse of the expectant mother, and if they meet the criteria, they would be allowed to accompany the mother, as long as there is a negative COVID test result of the mother as well as the spouse within the past 3 months. We do not have a quota. As for the discretionary arrangement, we understand that for premature birth, it is impossible to predict the actual labor. So when the pregnancy term reaches 32 or 33 weeks, then it's a term pregnancy and discretionary arrangement can be put in place. Now, the frontline staff members will be responsible for checking if the birth companion lives in the building with confirmed cases. This is also dependent on the self-reporting of the birth companion. At the same time, body temperature will be taken to make sure that the companion does not have any symptoms. And that is the arrangement in relation to premature labor, following the criteria that we've set out. The speaker is not coming through. The speaker is not using a microphone. Birth companion service does not cover C-section service. So if you're talking about emergency cases, then at the time of admission, if the screening test result hasn't been ready, then say if the delivery takes place 2 hours after labor, then I'm sorry that it cannot be arranged. Next question. Good afternoon from Hong Kong 01. I'd like to follow up on a number of cases today. May Sao House of May Tin Estate. May I know how many cases are involved? What about the additional units today? How far is this unit away from the units previously identified? As for Fong Chek House and the new confirmed cases, will sewer surveillance tests continue to be done? Because the compulsory testing notice is due tomorrow. So will the sewage test be suspended only when no more virus is detected? What about the case number of your staff in Tseung Kwan O Hospital? As for United Christian Hospital, there was an outbreak in Ward 2D, and the infectious period would end tomorrow. Will those staff members subject to quarantine resume work tomorrow, or when will they resume work? It is rumored that the environmental samples in Ward 2D are still tested positive to COVID. Is that true? And will patients be admitted to Ward 2D at UCH starting tomorrow? About birth companion service, I'd like to know why you've put this arrangement in place and what are the criteria, because at the moment we still have outbreaks in hospitals. And we also have the most stringent social distancing measures in place now. Is there a concern that they will be bringing virus into the hospitals? And what about the birth companion? Will he be allowed to stay for how long after delivery? For May Sao House, May Tin Estate, we have one more case today. Altogether, 2 unlinked cases of in this building, and they are on different floors with different unit numbers. For Fong Chek House, the Hong Kong U interdisciplinary team is conducting a sewer surveillance study, and they have their own criteria. As for the Tseung Kwan O Hospital, our colleague is just tested preliminary positive. We do not have a case number assigned. As I understand, for UCH, the colleagues concerned will complete the quarantine period on the 11th. So by and large, the ward can resume receiving patients on the 12th. As for environmental samples, I don't have information at hand. Yes. About birth companion. Let me explain the arrangement and the criteria. For birth companion service, to recap, at the outset of the epidemic, we once suspended the service, we later resumed it, and then we subsequently suspended it again, and we are going to resume it. We need to strike a balance because birth companion would give support to expectant mothers to alleviate her pain and the need for midwives and other medical needs. So we would call it a satisfactory experience for expectant mothers if they're accompanied. So with all the measures in place and with the cooperation of the expectant mothers and the birth companions, we should be able to control the risk of infection. We've also sought advice from experts who find our arrangements acceptable. Now, after delivery, should the birth companions leave at once? In theory, they should. They should not be allowed to stay in the delivery room after delivery.
Sorry, speaker's not coming through. My understanding is that, as I said, the patient's colleagues actually finished the quarantine on the 11th, so the ward should be able to be in operation from the 12th. Yeah, that's my understanding. Next question. Lady at the back. Ming Pao. About contact tracing. Department of Health and HA. In contact tracing, the interdepartmental electronic platform is in operation now. Which departments are involved? And through the platform, what sort of information can be obtained? And the Center for Health Protection, after tracing the first layer of contacts, would it pass on the information to the command center mentioned yesterday to have the second tier of contact tracing? How do you divide your work? Can you give us more details? And secondly, the Home Affairs Department last month, when they carried out serum tests at Sha Tin Ming Yue House, and then after that they refer various cases to the Department of Health for follow-up. So how many people have not yet performed the compulsory testing? Will they be held accountable, or have all of them completed the compulsory testing? And lastly, for the accompanying person service, now the pandemic is actually unstable. Under what circumstances would the accompanying services be suspended once again? Say when there's a cluster of infections in the delivery room, or under what circumstance? For the electronic platform for tracing contacts, it will keep updating and has more functions. So we're working on that. Social Welfare Department, Housing Department, say if there's a case and the address of that case would through the electronic platform be obtained, and see and to double check whether there's any discrepancy in the address concerned. So the e-platform has just been set up, and there's still areas that could be improved further and actually to be further enhanced. As for referred cases, that should be passed on to enforcement. I don't have the details. As for the command center for tracing contacts, initially we would look at the situation, and in the beginning we may look at the first layer of contacts and then pass on the information to the center and to find out further contacts. Once the system is up and running and smooth, we'll see what more we can do. As I said just then, we're trying to strike a balance. There are advantages with providing accompanying service, and of course all the anti-infection measures have to be strictly adhered to, so we need to control infection risk. When we will suspend in case of an outbreak, we don't have any criteria yet, but we will continue to monitor the situation, the pandemic, with the epidemic specialists. And of course, if there's a need, we would have to suspend the service. Any more questions? Anyone who haven't asked questions? Okay, last question now then. Dr. Zheng, you said that the Food and Environmental Hygiene Health team announced yesterday that they have 2 colleagues in Yaoqing who were infected. were there close contacts, and so the infected, among those 2 infected, is it their family members were also infected, that they work in the same team? What were their numbers, and also were they on patrol on the street? How about number of preliminary cases? More than 40 preliminary cases so far. So far, we only got 1 confirmed case, which is from the Food and Environmental Hygiene Department. And there's another preliminary positive case who went to the same place for work, but not in the same hawker team. We are following up on the situation with the department. Some colleagues may have to be quarantined, and there could be other preliminary cases involving family clusters.